Hi Arya,
Hi, ma'am.
how are you?
Fine, ma'am.
So let's start. I don't know, only you only join. Let's see if someone joins, they can join. Anyway, link is open. So we'll start. Okay, I will share my screen.
Okay, ma'am.
Let's share visible, right?
Yes, ma'am, it's visible.
So did you went through the last lecture slide?
Yes, ma'am, I went through.
So yeah, for those who are okay, want to listen to recording, I will introduce myself. So I am Harsha. I am an integrated PhD student in ICHR Berhambur. Currently, I am in the second year of PhD in Department of Biological Science. So that is about myself. Let's start today's session. So majorly last week was mainly regarding the main disorders associated with the neural system. So first day we learned about what is Alzheimer's disease. Like we got what is it was a general introduction to what is Alzheimer's disease, like major hallmark everything. Then second lecture it was mainly Parkinson disease. Third week it was followed by amyotrophic lateral sclerosis for ALS. Then fourth week it was mainly regarding the spinal cord injury. So first 3 weeks it is mainly regarding the brain disorders. Then third week onwards it is started with spinal cord associated neurodegenerative disorders also. And finally in the last week it's not neuron associated disorder, but even the other type of cell present in neural system, which are glial cell, also have some deformalities. So then sir started with the introduction to glial cell again, then specific function of each different types of glial cell, followed by the disordered part. So that was the last five lectures about. We'll go through each summary of each day lectures. So, Alzheimer's disease, it was really nice to know that, like, I also did not read about this novel, but I also wanted to read after whatever Sir was telling about this Irabi Black's novel. So, he nicely introduced about one patient. And also, I recommend you guys to go and watch a Malayalam movie called Tanmatra also for, I hope, Arya, have you seen that movie?
Yes, ma'am, I have seen.
Yeah. So that is also a nice movie to understand about the whatever their life journey, how pathetic it is, and how we cannot even imagine how horrible even we are starting to forget the daily things like where did we keep our brush, how to brush, everything. So it's a eventually progressive disorder. So it's a the disease is mainly affecting the memory. So which part of the system maybe is getting affected? It's in the Sir drew this part also. So memory is mainly organized by which structure inside the brain?
Hippocampus.
Yeah, so Alzheimer's is mainly affecting the hippocampus. Then he told about us like how this is occurring, what path is getting affected. So what is happening? So cytone, then followed by axon. So finally, the this pathway, the axonal pathway, will start getting die off, or it will get loosened due to the deposition of some proteins like amyloid betas or tau proteins. So due to the accumulation of protein, even there is activity question. Can you imagine in a test tube how the protein aggregates? Similarly, like in our body also there are for aggregation of protein, which leads to some inclusion body kind of structures. So if protein is accumulating like that, um, because protein, you know, the basic structure, secondary structure, alpha helix, beta sheet. So they all always have a tendency to club together. So when some disorder or something happen, Even there is no correct evidence up to now why the aggregation is happening. What is the initiation point for that? How suddenly, without any point, these proteins are decided to go and accumulate? So there is no answer for that. So when this protein accumulation happens over the axonal network, what happens? That part get dies off, and finally it will lead to the neuronal degeneration of that part, right? So that is mainly affecting in this hippocampus. So in and also in the last class we told in hippocampus is consisting of majority of what kind of neuron?
Pyramidal neurons.
Yeah, pyramidal neuron. So it's going and affecting the pyramidal neurons inside the hippocampus. Thus, the memory is like starts getting affected, and it's a progressive disorder. In the final stage, it's like the patient needs the help of they cannot live without the help of an uh, another one. So it's like in the final stage they will completely result in the loss of total memory. So it is such a disorder and no treatment have been investigated up to now. So that is about cause and all the things happening during the Alzheimer's disease. Then the second week was mainly regarding the Parkinson disease. So Parkinson disease also a neurodegenerative disorder. We can actually compare because in all these diseases, what is happening? Some neuronal processes are start getting dying out. So Parkinson is also similar, but the part that is getting affected is different rather than if you're comparing with the Alzheimer's disease. In Alzheimer's disease, it is hippocampus, but in Parkinson disease, it is mainly substantia nigra, mainly the motor cortex. So the neuron will be also different. In hippocampus, it's majorly pyramidal neuron. Here, the neuron is motor neurons. So what will happen? Here, information is getting up to the brain, but what will happen then? Due to some reason, the neuron found in that substantial nigra are starts getting like degenerating neuronal processes. Due to that, the dopamine secreting neurons they are unable to synthesize new dopamine or synthesize new dopamine. We know dopamine is a neurotransmitter. Dopamine is needed for the normal activity. So, in order to the lack of synthesis of dopamine, what will happen? We are unable to communicate properly, right? So this is mainly affecting the coordination activity. So it's a that's why it's also called a finally it will affecting the like the movement. So people are unable to. So this is also a slow progressive disorder. So finally they are unable to coordinate or it is finally leading to some movement characterized disorders. So that is mainly the thing. And how Parkinson disease occurring? Any idea? So we told it's due to dopamine is not synthesizing properly, right? In Alzheimer's, what was the reason? It is due to the deposition of some proteins. But here it is due to the reduction in a neurotransmitter level called dopamine. And also compared to Alzheimer's disease, there is some therapy associated with even there is a Nobel Prize for that invention also. That therapy is called as L-DOPA therapy. So did you went and read about what is L-DOPA?
It is a precursor of dopamine.
Yeah, it's a nice. It's a precursor of dopamine. It's a drug, right? It levodopa we call it as. So we'll discuss it more when we are discussing in the question answer session. So even in the 2000, Carlson got Nobel Prize discovery. It's not just for the invention. L-dopamine was known, but he used this for the first time for the treatment of the Parkinson disease or Parkinson, the rodents that was affected by this disorder. So this was almost the research found out that this after injection of this particular drug, they are like there is some progress in the disorder part. So that is about therapy part of Parkinson disease. Then the third week was mainly regarding The one another type of neuronal injury. Okay, there is some two activity question was there. So it was interesting. So that's why I put it here. How is Parkinson disease different from Alzheimer's disease in terms of chemical changes? We already discussed, right? Alzheimer's is due to the accumulation of protein, but Parkinson is due to the in some neurons in substantia nigra are unable to produce the dopamine due to the degeneration part. So that is about the chemical changes in associated with both of the disorders. But neurodegeneration part is the same in both in Alzheimer's as well as in Parkinson. Both are neurodegenerative disorders. Then what challenges are faced while drugs are to be transported to the brain through blood-brain barrier? So we all know that brain is like a very protective organ. There is a skull, then inside the skull, everything is protected, and also inside between the skull and inside part, there is again a barrier called blood-brain barrier, which consists of so many endothelial cells and all those things. So what is the problem? We cannot normally induce any drugs as like because in blood-brain barrier there are so many endothelial cells present. So they cannot take some large sized molecule like that. And why? Because they it's a tight junction. There is no much gap junction and kind of structure. So they cannot take large molecule and also hydrophilic molecule also. Why? Water soluble also molecule cannot go through the blood-brain barrier because the membrane receptors associated everything is lipophilic. So only lipophilic molecules can pass through or low molecular weight molecule which are lipophilic only can pass or crosses the blood-brain barrier. That is about blood-brain barrier. Then the third week was mainly regarding amyotrophic lateral sclerosis, right? So this is also a brain neurodegenerative disorder, but the major difference was this is affecting the spinal cord part mainly. AD, Alzheimer's disease, and Parkinson disease was mainly affecting brain. Okay, so just keep it in mind. AD and PD affecting brain, AD affecting hippocampus, Parkinson disease affecting substantial niagara, AD affecting pyramidal neuron or cortical neuron, then PD affecting motor cortex. Right. In ALS part, it is affecting spinal cord. Where it is affecting? It's affecting mainly the ventral horn. Okay. So the ventral horn motor neurons are generally get affected by amyotrophic lateral sclerosis. Then, so there is also not much evidence that why this disease is occurring and how this disease is occurring. But there is a antioxidant present called superoxide dismutase. So this is generally an antioxidant. Okay, you know about antioxidant. So these SOD mutants are also like around very less percentage of disease is characterized mainly by the SOD mutant. So there is some link between this mutant and this disorder. And that is mainly about this disorder. Here also what is happening? The same thing only. The neurodegeneration is happening, which leads to like the typical example is Stephen Hawking. So we know that the motor neuron is affecting, and the motor neuron is able to control a lot of activity inside our body, like the speech part. So they are unable to properly do the communication. But still, there are some interesting fact that they can blink the eye muscle because that muscle is also controlled by motor part, but that is not affected. But some part of the motor neuron affecting functions are getting affected. So why only some specific function and all these are under research question? Okay, so that is mainly about amyotrophic lateral sclerosis. Then we also told about the difference between Alzheimer's, Parkinson, and ALS. Then the fourth lecture was mainly regarding the spinal cord injury. Okay, so what is spinal cord injury? How it's happening after like a sudden accident or something? What will happen? So in spinal cord also there are a lot of neuro present, and there is a type of neuron which is very large neuron. Like that. Do you remember what is the name of that neuron? It's really large sized neuron. Some neurons present in the that part. Okay, go and refer. Okay. What is the particular feature of that neuron? They are large in size and also, so how this injury is happening? So there are these neurons. What will happen whenever some damage occurred? Okay, so that damages the blood-brain barrier present there. So after blood-brain barrier is degenerate, like if the damage happen, then what will happen? It will create an injury to the motor neuron. So what is the larger neuron present there? Motor neuron present across the spinal cord, which is very large in size. And this motor neuron gets starts dying off as a result, but still there is possibility, right? If they are degenerating, they can because there are so many stem cell present, so it's also possible that they can again synthesize the neuron and finally come back to the normal routine. But what is the problem? After that motor neuron is getting died off, that will leads to the influx of some kind of blood cells like WBC macrophages, and also, do you remember one of the glial cell that we talked about in one of the first class, which is called as microglia? So microglia is also a glial cell. These are immune cells in nature, and the after the injury to the motor neuron happen, this will leads to the infiltration of the macrophages along with the microglia. So these are very large cells. After they get activated, they will start producing processes like that, long processes. So finally, it will lead to a structure where it's a pond-like structure. Only central part is fluid surrounded by the cell processes. It's like a pond. So that structure is called as syrinx. Okay. So syrinx fluid is formed. So what are the major possibilities? Either we need to remove the syrinx, like we need to drill that part and take out the fluid. That is also not possible that much. Or we need to target there with an antibody such as growth inhibitor antibody. Why? Because this inflammation is creating this fluid kind of structure. And also after this fluid is present there, there are some components present in the inside the fluid which is causing the neurons, which is not allowing the neuron to for the growth back again. So if that fluid components are not there, which means neurons can again come back to the normal nature. But this fluid is not allowing for that. So either we need to remove the fluid or we need to do the target them with some growth inhibitor antibody. Okay, so there are many kind of translational level therapies going on. Two we already discussed, and also there is stem cell therapy are also there. Like there are different types of stem cell present, adult stem cell present across this part. So actually researches are going on in there are also some papers regarding this also. Like they proved that if we are providing some injecting the site again with some adult stem cell, they can again go back and rebuild the that part. Okay, that died of neuronal processes. So all these translational level therapies are going on. Then final lecture was mainly regarding the glial cell. So what are the type of glial cell? There are three different types of main types of glial cell are there. Fourth type is the microglia. We discussed they are immune in nature. Then Schwann cell and oligodendrocytes are there. Both of its function is similar, but the location they are found is different. One is in central nervous system, while the other is in the peripheral nervous system, and size is also different. But function is same, which is myelination. So Schwann cell and oligodendrocyte are involved mainly in the myelination. And then there is one more type of cells, glial cell, which is called as astrocyte. So astrocyte is the one of the main cell type that maintain the homeostasis by secreting new neurotransmitters providing the nutrients. So there are so many um, function that is maintained by the astrocytes. So what is the advantage of myelinated neurons over non-myelinated neuron? If we are checking the myelinated neuron, we can say that myelination is increasing the speed of transmission of electric impulse or through the neurons, right? And also there is some part of in that part where myelination is not present. That nodes are called nodes of Ranvier. So that type of conduction where only like it's like a jumping of information from the node one nodes of Ranvier to the other. So that type of conduction is called as saltatory conduction. So how myelination is helping in this? Since the neuron is myelinated, it will helps to maintain the easy transmission of this impulse, and also these are electric signal, which means it acts as a coating. So there won't be any like much reduction in the loss of signal. But suppose if the neuron is non-myelinated, still it can pass. But what is the problem? If these are non-myelinated, which means that there will be loss in signal transmission across. So if is starting with some signal, by the end of the time, the much more there is the complete information won't be get passed. So there is loss of signal will happen, and also there will be reduction in the speed also. But this is also an advantage. There is only one condition that is advantage for the non-myelinated neuron, where are explained that that is mainly regarding the pain, right? So whenever the pain thing receptors are happening, these neurons they will easily take the non-myelinated neuron to pass the information of pain through this. So that is the only one case, because we know it should be delayed, right? So that was mainly regarding the difference between non-myelinated and myelinated. Then the final was regarding the Schwann cell and the oligodendrocyte. Which is larger here, Schwann cell or oligodendrocyte? Anyone remember? Is Schwann cell is larger or oligodendrocyte? Schwann cell is like one neuron. It's one neuron over there are so many cells, Schwann cell, which helps in producing that myelination over the neuron. But oligodendrocyte is very like larger and it have multiple processes. So one oligodendrocyte, due to their multiple process, even can myelinate multiple neurons. So that is the advantage of oligodendrocyte over Schwann cell. And also, which cell is present where? Schwann cell is present in CNS or oligodendrocyte is present in central nervous system. Do you remember?
Oligodendrocyte.
Okay, so Schwann cell is present across
PNS.
peripheral nerves. Very good. So that was the mainly regarding the glial cell. And also there is a one not neuro, there is a disorder characterized by loss in this Schwann cell. Do you know what is that disorder condition called?
Multiple sclerosis.
Yeah, multiple. It's an autoimmune disorder. So there are some disorders associated with glial cells also. So mainly this week was mainly regarding the disorders associated with neural system, Alzheimer's, Parkinson, amyotrophic lateral sclerosis, spinal cord injury, followed by the glial cells affected disorders. So I hope you guys remembered through all the 5 lectures. So now we'll go through the questions. Okay, you guys can type in the chat box. We'll discuss. Then we'll move through the next question. So let's start. Pyramidal neurons are unipolar, bipolar, multipolar, or all the above. I think we discussed the same question in one of the earliest sections. So you guys can text in the chat box option A, option B, option B, or option D. What happened? Okay. Arya texted. Tenmari, can you type anything? A, B, C, or D? Hello, Tenmari. No response. Okay, so let's discuss. It is multipolar. We already discussed also. This is the most abundant neuron present across the cerebral cortex. And these are multiple, they have multiple processes. So I will show you the image of pyramidal neuron. Okay, they look like this. This. So you can see there are multiple branches. So they are pyramidal in nature. So pyramidal neurons are multipolar. Why they are in pyramidal? Because they look like a pyramid nature. That's why the name comes from. Then these are the most abundant present across the hippocampus as well as cerebral cortex. Next question. What human ability is majorly affected by Alzheimer's disease? Motor control, hearing, sensory control, memory. Okay. Yeah, we already discussed that, right? Because Alzheimer's is mainly affecting the neuron present in the hippocampus, and hippocampus is one of the major part that coordinating the memory part. So definitely the answer is D. So I don't think I need to go and tell about it. If you have any doubt, you can ask me. Okay, then third question. Neuronal process in what part starts die off in Parkinson's disease? Amygdala, substantial nigra, hippocampus, pre-board Singer complex. Okay, yeah, that also we showed in that figure, star blue, that figure, everything, right? So it's always affecting substantial nigra or motor cortex present in the substantial nigra, which will leads to the loss in the coordination. Then, which part of the brain is majorly affected by Alzheimer's disease? Okay, option is same only. You can just write there. Yeah. So I'm not going through that question again. What neurotransmitter was originally secreted by neurons before dying off in Parkinson's disease? GABA, glutamate, dopamine, caffeine. Which neurotransmitter is affecting in Parkinson? Yeah, dopamine. Correct? We that also we discussed, right? Then, which of the following is a treatment for Parkinson's disease? L GABA, D GABA, L dopa, D dopa. Yeah, L dopa, right? Why L dopa? L-DOPA's full form is levodopa, and we already discussed about what is levodopa. It's a dopamine precursor. So, what is the advantage of dopamine over L-DOPA over dopamine? Dopamine cannot cross the blood-brain barrier as such, like if you are directly injecting dopamine, but L-DOPA can cross the blood-brain barrier, and after reaching the correct part, there is an enzyme which converting L-DOPA into the dopamine. So that's how dopamine replacement can be happen through the L-DOPA. And it is used to control the bradykinetic symptoms or like the motor coordination activity symptoms in Parkinson disease. Who is the person? That person was a Swedish scientist called Arvid Carlson. So he actually did this work during 1950, but after 50 years, he got the Nobel Prize for the discovery. So mainly he was doing this for the reduction in intensity of animal symptoms for the Parkinsonian symptoms. So now Which of the following is not a glial cell? Astrocyte, oligodendrocyte, Schwann cell, neurons. Yeah, because we know the other three are we already discussed in the fourth part. So neurons are the not a glial cell. Okay, now programmed cell death is called apoptosis, necrosis, cell injury, external chemical induced cell inflammation. Programmed cell death. Okay, option A. Do you know what is apoptosis? Can you tell me something about apoptosis?
It is mostly seen in the cancer cells, where the cell itself will program to the death after a certain number of divisions. And this thing is
Yes.
absent in cancer cells, that is why they proliferate a lot.
Yeah. It's not only there are other places also, but yeah, that definition is correct. It's a programmed. It's like cells want to kill some type of cells. It's like a part of our main part of the immunity, right? So there are some uh, enzymes that are present which can do this function. They can digest or incorporate or invade the other cells that are involved in the cell death to the site of infection and can do perform the apoptosis, which will finally, after everything, which will finally lead to the apoptotic bodies. So, next question. Jumping of nerve impulse from one node of Ranvier to another is called orthodomic conduction, antidomic conduction, saltatory conduction, action potential. Yeah, we already discussed saltatory conduction, right? It's the jumping, correct definition. But what is orthodomic conduction? Any idea?
No, ma'am.
Okay, this is just the definition for if the direction of flow of the signal is like normally from the cell body to the dendrite end, then the normal way of signaling transmission is called orthodomic. Antidomic means it is opposite. In certain situation, if the flow of signal is from the opposite direction or from the like the axonite end to the cell body end, the opposite way of transmission is called as antidomic. Okay. And action potential, we already discussed a lot. So I don't think we need to discuss it again in the previous classes. Right. Then let's discuss week 6 assignment. There are still a lot of time. We'll go thoda sa slowly, okay? Schwann cells are option A, myelinating cells in central nervous system. Option B, myelinating cells in peripheral nervous system. Option C, myelinating cells in central nervous system and peripheral nervous system. Option D, myelinating cells specialized only for nerves in the stomach and are not found anywhere else in the body. Yeah, Arya already told option A. Hello, Tenmuri, are you there? Can you please type the answer? Whatever the option, if you don't know, it's fine only. You can guess any option. It's not recording, okay? B in PNS. Okay, sudden change. Sure. Yeah, when you told me Schwann cells are in PNS and earlier oligodendrocyte are in CNS. Yeah, let's see what is the correct answer. Is B only. Schwann cells are embryologically they are derived from the neural crest and they always myelinate the cells over the peripheral nerves. And in the peripheral nervous system, they act as the main cells, main glial cells. And also, they also do the nutrition process also. They provide the essential needed nutrients to the axon present there. So, next question. Oligodendrocyte are. This is easy. Now only we discussed. If Schwann cell is over PNS, then oligodendrocyte over, yeah, CNS, central nervous system. Right? So they form mainly myelin sheath over central nervous system, and we also discussed they have multiple processes. So one oligodendrocyte even can myelinate multiple nodes. Then next question. An excitatory signal between two neurons. Option A increases the intensity of action potential by tenfold. Option B decreases the intensity of action potential by tenfold. Option C increases the probability of generation of action potential in postsynaptic neuron. Option D decreases the probability of generation of action potential in presynaptic neuron. We already discussed everything in the last week. Yeah. Option C. Okay, that is the correct answer, right? We cannot say it's by tenfold without saying just an excitatory signal, but we can definitely say that excitatory signal is there are two types of signal, excitatory and inhibitory. Okay, so even in each of the junction between multiple neurons, some neurons may be in excitatory in nature because they release the such type of neurotransmitters, and another neurons are inhibitory neuron where they release the inhibitory neurotransmitters. But how the cells will decide, because if after adding up the effect of all the excitatory neuron present and inhibitory neuron, if it's again some excitatory like the positive feedback in nature, then the postsynaptic neuron will be definitely excitatory in nature. So option C is the correct answer. Then next question. So this will be opposite, right? Inhibitory signal between two neuron. Options are same only. So what will be the answer? Yeah, decreases the probability of generation of action potential in postsynaptic neuron. How they are doing that? How they decreases the probability?
They open up the anionic channels.
What kind of neurotransmitters? Any two inhibitory neurotransmitters that we learned?
GABA,
Yeah. Then,
dopamine,
yeah. And the disorder associated with dopamine is,
Parkinson's.
so everything is connected. So if you're studying also, whenever we are studying, if we are studying it in a connected manner, then it's easier for us to remember also. So yeah. Now next question. The signal travels within the neuron is dash and between the neuron at the synapse is dash. Option A electrical, option B electrically or chemically, option C chemically and electrically, option D chemically and chemically. Within the neuron, between the neuron, how the signal travels. Is it electrically? What is electrically? What is chemically? Or both are electrically or both are chemically? Is the question. So what is the answer? Okay, electrically and chemically. Yeah, that is the correct answer because why it's happening? Normally within the neuron, we told it's a saltatory conduction, right? Which is means electrically just transmitting. But between the neuron, there is no connection between physical connection between two neurons, which is result in there is a space which is called a synapse junction. So through in order to pass out that space, electrical conduction is not possible now. So they will secrete a particular time of chemical called neurotransmitter. So that is chemical transmission. So always between the neuron is chemical transmission and within the neuron is electrical transmission. So correct option is answer B. Right? I don't think I need to explain again, but I will read. Okay, so we explained all this, what is synapse and what will happen within the neuron. Information is passed through the movement of an electrical charge, or that is simply called as impulse, right? So therefore it is called as electrical transmission. And so when we consider it two neurons, one will be act as presynaptic neuron, the other will be postsynaptic neuron. So from the presynaptic to postsynaptic, in the presynaptic neuron, there are so many vesicles across the end of the axons or axonite. These synaptic vesicles are stored with some certain chemicals called neurotransmitters. So it can be either excitatory or inhibitory neurotransmitter, but these are chemicals, right? So whenever it needed, the synaptic vesicle release this neurotransmitter, and then postsynaptic neuron, there are so many receptors present across the dendrites which can accept the neurotransmitter released from the presynaptic neuron, and thus they enable the chemical transmission across chemical signal between the neuron. So correct answer is option B. Question 6. Efferent neurons, also called motor neurons, are the nerve fibers responsible for carrying signal from dash in order to initiate an action. Option A, brain to peripheral nervous system. Option B, peripheral nervous system to brain. Option C, both A and B. Option D, none of A and B. Last time we told so many times, please remember through all the names for the both afferent pathway and efferent pathway. Yeah, because efferent, the meaning itself is descending. So it is mainly from the, no, you are telling option B. Okay, okay, option A. So it's efferent means descending, right? So it's mainly from the brain to the peripheral nervous system. So efferent fibers refer to the axonal projection that exit the particular region, and afferent means they are entering or they arrive at the region. So in PNS and central nervous system, these terms have some difference. What is the difference? So efferent fiber means it's a processes that always project from neuron cell body, and they always carries the nerve impulses away from the central nervous system or brain towards the peripheral nervous system. So if someone is asking where is the cell body of this efferent neuron, what will you say? Cell body of this efferent neuron, where is it present?
In the ventral horn,
Why specifically ventral horn?
because it should travel from the spinal cord to the
It
effector
can be
muscles.
brain also, right? So I just mean,
Ah,
is it central nervous system or peripheral nervous system?
it's in the central nervous system.
Yeah. And if some question is asking like, okay, I think there is one question in the last, I don't remember. Let's see. Yeah, the same question. The cell bodies of efferent neurons, you already told. What is the answer?
Central nervous system.
Yeah. So option A. Now next question. Cell bodies of afferent neurons are it? Afferent or ascending?
Peripheral nervous system.
Yeah. Easy. The longest process of a neuron is called.
Axon.
Yeah. What is the smallest processes present across neuron?
Dendrites.
Yeah. Where is the action potential originating inside a neuron?
Axon hillock.
Okay. You are ready for examination. The conduction speed in neurons dash with effective myelination. Option A increases, option B decreases, option C does not change, option D it cannot be calculated. So actually this question is basically from today's topic. We basically did not went through this part of myelination, Schwann cell, everything yesterday last class. So now after today's class you can answer this.
Increases.
Yeah, because it's an insulation, right? So it will maintain that speed also. So last time we already discussed the week 4 assignment question. So today I think we'll go through one more. We'll discuss week 3 assignment discussion. Let's see. Then if you have any doubt, we'll discuss that also. Then we'll end the session. Dash are myocardial cells. Option A neuron, option B pacemaker cells, option C beta islets, option D nephron.
Pacemaker cells.
Why?
Because it is found in the heart, the all other options are not found in the heart.
Yeah. So we remember what is cardiac cell. Myocardial cells are present across the whatever the term associated with cardia means there is a heart relation. So pacemaker cells are the cells that are present in the heart. So correct answer is option B. So these myocardial cells are the mostly abundant cells present across all artery and ventricle, and these are constitute 99% of total cells. Um, so what is the peculiarity of these pacemakers?
They initiate the heartbeat.
Yeah, that's why we told when we are discussing that we also discussed even a heartbeat can beat if it's just taken from the heart outside also. It's due to the sinoatrial node present across this type of thing. It's automated. It don't need to like depend that much for the brain for its loved up. It can create that by its own mechanism. So next question is arteries are made up of smooth muscle, skeletal muscle, cardiac muscle, all the above.
Smooth muscle.
Yeah. You remember about skeletal and cardiac, right? So smooth muscle is the muscle that is constituted in all type of blood vessels. So they are needed for maintaining that integrity of the arterial wall. So what is its main function? It is designed such that the blood will flow smoothly, right? So these muscles will enable the flow of blood flow smoothly across all these arteries and ventricles. Which of the following is not a component of skeletal muscle force dynamics? Calcium ions, actin, myosin, troponin, tropomyosin. Option D, nodes of Ranvier.
Nodes of Ranveer.
What is the function of all other option if they are present across skeletal muscle? We'll go one by one. What is the function of calcium?
Calcium will unwind. It will bind to the troponin and unwind the tropomyosin and makes the site of actin visible to myosin for making the cross bridge.
Very good. Correctly said. Actin, myosin.
They form the cross bridge and leads to the contraction of the muscle.
Yeah. Then finally, troponin and tropomyosin. What are those things?
That
Where is this present? Is it in
is
actin or myosin?
actin.
Okay, what is troponin?
Both are basically proteins, and tropomyosin will actually bind the actins together, and the troponin act as the nodes at the points. And if that is present, the active site of actin will be masked, and if calcium binds to that, it will get unmasked because this troponin will lose its configuration and it cannot hold that for any more time. So it gets unmasked.
Very good. I'm seriously saying you are ready for the exam.
Thank you, ma'am.
So, and what is nodes of Ranvier? Anyway, you told about every. Where is that present? What is its function?
Present in the neurons
Okay.
across the. It's a point in the neuron where there is no myelin sheath,
Hmm.
and it helps in the solitary conduction of impulses.
Yeah, which we discussed today only. Now, next question. In skeletal muscle, which of the following prevents the interaction between actin and myosin? Option A, myotube. Option B, actin. Option C, tropomyosin. Option D, troponin.
Tropomyosin.
Yes, correct. How it will maintain that?
It
Because
will
that will,
bind the actin together and will
yeah,
not
it
allow it to.
wraps around the actin so that myosin normally cannot go and bind with that part. Otherwise, if tropomyosin is not there, what will happen? Myosin can bind with actin and leads to the contraction. It will result in the contraction or shortening of the sarcomere. Hmm. So, next question. Satellite cells are dash, dash, dash. It's a stem cell differentiated to myocyte. Its fully differentiated cells are derived from myocyte. It's a fully differentiated cells that differentiate to myocyte or stem cells that are derived from myocyte.
The stem cell which can differentiate to myocytes.
Yeah, when we studied also, he in that part he explained very nicely that they have some like they can be used in the regenerational therapy also. So research are going on using the satellite cells because they are stem cells that have the potency to become myocyte, right? So they are basically adult stem cells. Then actin, myosin are carbohydrate, protein, fats, all the above.
Protein.
Yeah, no doubt in that, right? So I don't think you need to explain that. There is an interesting fact that given in the solution. Did you read through that? It's written there. I will read, okay? The term protein to describe molecule was proposed by Mulder's associate Berzelius. So Berzelius is a famous scientist. So protein is derived from the Greek word, right? It is read as proteos. So proteos means primary or it means standing in front, right? So that is why plus minus in. So proteins started with, so it's an interesting fact how the name derived from. So proteins end in, the last two words are in, right? Starts with proteose. So the if you are reading together, what is the meaning? Proteose means in the lead or standing in front, ending with in. So go through the solution also, you will get such interesting facts about each thing. Sorry, I didn't hide the answer. Yeah, but I know you already know. The length of sarcomere is length of I band, length of A band, length of I band or length of A band, distance between two Z lines.
It is a distance between two Z lines.
You remember all other band, right? Isotropic, anisotropic. Just go and refer also if you forgot. Then which of this is non-striated? Skeletal, cardiac, smooth, rough muscle.
Smooth muscle.
Yeah. Which of these has no actin? Axon, IBAN, exon, AISO. We discussed the same question, right?
Yes, ma'am.
Uh, what was the answer?
Head zone.
Yeah. Why?
It
Exon is
only
a,
has myosin.
yeah, exon is present. So it is basically within the A band is a paler region called exon. So why it is called, all this name comes from, it's interesting to read through because H means heller. Heller means brighter. So it was look like lighter in appearance. So that's why they coined the term heller or H zone. So it's basically consists of only myosin or thick filament where there is no. The sarcomere length dash when actin myosin overlap increases, decreases, is unchanged, none of the above.
Decreases.
Yeah, definitely, right? Actin myosin overlap means two Z lines are coming closer or it is total length is getting reduced or it will definitely it will decrease. So think about the sliding filament theory, everything. So any doubt across all these things, especially today's last week's topic, Parkinson, Alzheimer's, and spinal cord injury, amyotrophic lateral sclerosis, finally about glias. So is there any doubt?
Can you once again explain the spinal cord injury where that fluid is forming, that syringe?
Yeah, yeah, sure. So basically, after any sudden, if suppose sudden an accident occurred, okay. So due to the sudden injury, the blood-brain barrier there got broken. So we know that all these across neural system blood-brain barrier is acting as a very really a barrier for the protection of all these neuron inside it. So what will happen if there is no blood-brain barrier? So due to that sudden attack, the neurons present across that, which are not motor neurons, or whatever the neuron present across that part also got degenerated. So what will happen now? First, the damage of blood-brain barrier occurred, which leads to the injury of the motor neuron. So that will lead to the influx of some blood flow, like blood vessels. So that include WBC, macrophages, everything. We know that these are large cells, right? Macrophage, everything. And also the glial cell called microglia. So microglia is basically a glial cell that in normal condition it does not have any like that much function. But whenever this thing is happening, it is observed that microglia also get infiltrate to the site of injury. So basically these are very large cells, right? So they have large processes, everything. So what is the normal happening if some axon is getting degenerating there? What will be the mechanism for that? Axon should be able to regenerate, and then we know that the information will be processed normally. But here, after these cells are such a larger in size and everything, and also they will start producing multiple processes, everything around some part. Okay. So you just imagine the spinal cord part and the injury occurred, blood brain barrier broken, and now there are some cells surrounding that part which is acting as a, so you just imagine a pond condition. In pond, what is that? Inside that there is some water surrounded by some kind of soil or whatever the thing. So this barrier is, the round part is constituted by the cells. So inside that there is nothing, right? So there will be a fluid accumulation, and around that there will be all these cells, especially microglia, macrophages, etc. So that fluid is called as fluid condition created inside after the injury is called as syrinx fluid formation. Did you understand?
Yes, ma'am. But why are we using the growth inhibitors there?
Okay, so how this is happened is due to that processes elongation of the particular cells found there, right?
Yes, ma'am.
So if you are targeting the growth inhibitors and if you are able to block that barrier around the pond-like structure, then is it possible to, it's some hope is there. We can bring back to the earlier kind of structure, right?
So the growth inhibitors are targeting the microglia or the WBCs from further growth.
Yeah, I understood like that, but now I am also getting confused. 1 minute. Okay, 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 okay. Sure. So antibodies against growth inhibitor is there. So growth in they are targeting basically growth inhibitor present there. So and I also told, so now there are some, these cells are there inside the fluid. There are some components which is basically not allowing the neurons to come back to the normal, to regain its normal length, right? Which means those are growth inhibitors. Did you got my point?
So the fluid basically contain the growth inhibitors of the neuron.
Yes. Yes. So that fluid components present inside that fluid is basically not
Inhibitor.
allowing the neuron to come back to attain the normal processing formation. So basically, if we can target the antibodies and we can understand, oh, so and if somehow if we can remove that growth inhibitor, which means that they can again start regaining the normal length. And also there are some stem cell present across this part, but there is no, it cannot activate on that part due to the formation of this fluid and also the component growth inhibitors present inside that. So if you're able to remove that thing, then which means that it can again, there is a chance. That's why he also told us a third method to activate this by using some electropolymers, and can act as a channel. Do you remember?
Yes, ma'am.
So basically, somehow we need to find out some mechanism to activate or regain the axonal generation in that part. So that are the translational level therapies. So we are implementing the research to bring a cure for these disorders. So did you understand?
Yes, ma'am. It's clear.
I also suddenly when you ask got confused, but yeah, when I read through that, I understand. Mm, then yeah, is that only? Any other doubt?
So if the neurons are regenerating, is it with the help of the stem cells?
Yeah. So
Then why not this is happening in the brain for the neurodegenerative diseases like Alzheimer's and
nice
Parkinson's?
question. Because there is no, sir was telling about some dentate gyrus, remember, right?
Yes, ma'am.
So dentate gyrus, there is, so earlier what happened was people was assuming that there is not at all, the adult stem cells are not present across the brain. So whenever neurodegeneration is happening, people thought that, oh, there is no cells present across the brain so that it can regenerate the new neurons. Then people found out that no, that is not the condition. There are stem cells present across these parts and dentate gyrus, and there is also one more part inside the brain where these are happen. But it is not easily accessible, and also it's not like so every potency of every adult stem cells varies from different organs. So do you know about liver, right? Whenever something is happening to liver, it easily can regrow again, right? Which means the adult stem cells. So every cells in our body is really, really different. So even that is the interesting fact about the stem cell also. So some stem cells can do that, but again the potency of some unique stem cell varies. So now people understand that there is some stem cell present across. So there are actively we are thinking of the researchers using these stem cells been again. So if we need to plan some experiment or research using the application of stem cell, there is multiple barriers to cross. There is we need to think about even brain is like a such a unique structure, right? So there are some ethics associated with, and also that is the thing that is delaying all these researches. And also, sir told about one more thing. Any drug administration or any treatment for brain is really difficult due to the skull and the blood-brain barrier. So if we need to inject anything to the particular site, also we need to make a hole in the skull part and then we need to administrate it there. So all these processes are very. We don't know if we are doing that thing, what will happen next. It will cause some other problem or not, right? So that is the problem associated with all these things, especially to the brain, skull, blood-brain barrier. So drug administration normally happen. So even though some stem cells are present there, if we need to think about the active and what will happen mainly in all these cases of neurodegenerational disorders, sometimes whenever injury is happened, it is also we can see that after the injury, the first cells that starts dying off will be this stem cell only, like the spinal cord injury we are explaining, right? So there are some components that inhibiting the regrowth of the thing, which means they are inhibiting the stem cell activity. So there are such multiple characters for all these disorders. That is also a challenge. Did you got my point?
Yes, ma'am.
Yeah. So all these things are really interesting, like regarding the stem cell application.
So when the stem cells are growing, do they continue the remaining portion of the neuron or they create a new neuron itself?
So that also, so it axon. So how this all these things are created. So basically, if the processes is not there, there will be some part or something that is enabling to continues the normal growth. So or the replacement of the old neuron, right? So that activating of electric polymers, everything is just the second method only. So if you are activating some polymers inside that, which will activate, it will continue the further elongation of that part, and it can continue the processing formation. But if we are telling about the stem cell process, what is happening there? If you are administrating more stem cell there, so which can again create new neuron in replacement of the old neurons. So these two things are possible. Understood?
Yes, ma'am.
Yeah. So, any other doubt?
If the stem cells create the new neuron, as you told, then what happens to that remaining portion of that older neuron?
So we don't need, na. We just need to maintain. Don't imagine like all these things are like such a way regulated. So just imagine like if there is a something to replace the older one. So our body always tries to somehow maintain the normal homeostasis, right? And also there are like if something is not in functional, our body have other mechanism to replace that and to eliminate that part. That's why all the immune thing, everything is coming into role, right? And all this, so as we said, the myelin cells, there are something to give the nutrients, such that there are also components that is normally eliminating the non-wanted parts also. So just body have its own mechanism to maintain the normal homeostasis every time. But the condition here is in that syringe fluid, there are components that inhibiting all the regrowth or whatever the thing. So it's not axon is not able to regenerate as such in a normal way. And also there are stem cells present there, but that stem cells are also not able to do its function because of these components. So either we need to remove that fluid or either we need to uh, target that growth inhibitors. So that is the thing. And just go and check through the like spinal cord injury translational therapy using adult stem cells. There are papers you can read about that.
Okay, ma'am.
Nice discussion.
Yes, ma'am.
So any other, do you interested in stem cells?
I don't know, ma'am. I just thought of asking you the questions. I didn't plan it, but it happened on its own.
So do you know what are the different types of stem cells?
Different types? No, I don't know, ma'am. We
Oh,
have a paper to study on that on next semester, so I hope I learn it then.
okay. So basically, I can give you some like hint too. It's really interesting. I am actually interested in knowing about stem cells. So
Okay.
basically, what will happen in a zygote? You know zygote, right? Our first cell. So
Yes, ma'am.
zygote, that cell is like really, it is called as totipotent. It has the potency to become whatever the thing it wants, right?
Yes,
So
ma'am.
these cells are totipotent cells, which is that embryonic stem cell. So they can become any part they wanted to become. But after that, after the morula stage come occurred, you know the development, right?
Yes,
Eight
ma'am.
cell cleavage. So after
Mm.
the division, so after the morula stage, it's again potency somehow will be restricted to some lineages like the ectoderm, endoderm, meso. Some will be can become ectoderm, some endoderm, some mesoderm. But that first two cells can become any part, like any lineages. Then again, if it is becoming and like during the process, so when you become an adult, okay, there are again some stem cell present called adult stem cell. They are basically unipotent, which means so only that cells can not cannot produce every cell that they want. They are restricted to again to some specific cell type, like the cells present across if somehow uh, especially the in the blood, right? You know there is a precursor cell in the present across bone marrow. Then they can present anything, RBC, WBC, platelets. So there is, all these things are derived from one single stem cell. Then that stem cell can again some precursor cell, which is again making the RBC, then some for WBC, some for platelets. So the potency of stem cells varies. So it's depending on the what type of the organ also what so adult stem cell also have different types of functional characteristics. So it is totipotent stem cells are the only stem cells that are present across zygote one. Then there are multipotent stem cells. Then there are also unipotent stem cells which are generally seen in the adult stem cell. So now there are so many researches going on regarding this So my research topic is also regarding the adult stems, using some parties coming across using the adult stem cells in the kidney part. So these things are really interesting.
Okay, there was a recent research which happened in Israel where they developed an embryo from a stem cell.
Yeah.
Did you read about that?
So that is possible, right? If you're thinking like just thinking of that first two cells inside the zygote. But I again the villain here is the ethics associated. So if you want such a totipotent cell, it should be from the mother's that first fetus cell, right? So there are so many ethics associated with that thing. And now, so after such some incident, it's country-wise country it varies. So there is some restriction for getting the access for all these cells. So that are the things. But these all things are possible. Okay, I lost my. Uh, hello.
Yes, ma'am.
Sorry, I lost the connection. Did you hear what I said?
Ah, yes, ma'am, I heard.
Oh, okay, okay. Uh, So that's interesting facts about all these things about stem cell. And also now there are stem cell banks, right? Everything it's active. So people used to give the stem cell and store it for the thinking that it will be useful for the. So there are active researches going on regarding that. So now there are so many stem cell banks also.
But that is very less in number in India, right? It happens in the foreign countries.
No, no. Now nowadays,
The stem
like
cell.
I know, like the people who, whenever they, like during the time of the delivery period, right? So now people used to give don't like there is some organization, so we need to give some kind of amount to them so that they will collect and store it in the particular bank. So people are getting aware about these things. The one problem is they are unaware. What are the advantage of using that? And so nowadays people knows what is things and how things are going on everything. So nowadays it is in India also people do that. Yeah, but relatively it will be less. It's depending varies on the country. But compared to some earlier time, it's increasing. I'm saying.
Okay. So if we collect the stem cells during the time of delivery, and will it be useful to treat the diseases like Parkinson's or the Alzheimer's if the child develops it in the later stage? Will that stem cells be used?
So
Is there a
that is a. Do you
possibility?
know about the organoid?
No, ma'am.
Okay. So there are so many things interesting about things. So if you are doing that kind of a stem cell, it's like even when we are telling about the skeletal muscle, so Sar was telling about the satellite cells, right? So these satellite cells are or adult stem cell. If something happened to muscle, the researchers are going on to find out is these satellite cells are able to regenerate all that surrounding cells that are happening due to the injury. So if we are storing the stem cell, which means that it is possible to regenerate to some part or up to some level. But again, the problem comes when we need to inject back into the like whatever the patient or wherever we need to. So if some child is born, okay, so and stem cell was already stored, so that is like a look. The option is it's always better to have something if you're thinking of nothing, right? So that something hope will be there always if you have that stem cell. That is the better answer, I guess. But the problem is in India now there are okay, again my net is lost it. I don't know. Did you hear listen to me?
No, ma'am, I didn't listen.
Okay. So I was saying it's possible. It's possible to, but again, it's part wise part. There is again some risk to how the potency of the cell varies, how we can do in a research level condition, and then we can inject it and becoming, and also what happened, one demerit associated with all these things. So we cannot, I told you these cells can differentiate into any lineage, right? But think about the situation, we cannot control its division, right? We should tell them, okay, you should stop your division after becoming this type of cell. They are stem cell. They can continue the division. So what is the demerit? Sometimes the formation, the risk of tumor formation is there. We cannot control the division, right? So it will result in proliferation, which will the one of the risk associated with that. So people are afraid that if it will leads to such type of condition, will be again a risk for that disease, right? So that is the negative part of the side. But it's always better to have something rather than thinking of a nothing. So if that thing is, there is a hope that we can do this thing, but the again risk is, so we call it as teratoma. The risk of teratoma formation is there in the stem cell therapies. Do you understand?
Yes, ma'am, but why can't we control the division then?
We cannot control,
See, in the
right?
case of neurons, neurons as such cannot divide. So,
So
will it
that
be possible to do use them? Because they don't divide further once they are formed.
that is the thing. If these are like, so we need to suppose in the in vitro condition, we are differentiating it to the neurons, right? Then we cannot inject it to the neuron wise neuron. So we need to inject only the neuron stem cell, right? We are not injecting, replacing the neurons directly. Then we need to replace the neuron directly. Then there is a challenge of the accessing to the blood-brain barrier and the skull part. One thing. So second thing, if we are accessible to that also, we some cells that are able to generate neurons only we can introduce there. So if we are doing it in vitro and we are converting it into the neuronal stem cells, and then we are injecting the neuronal stem cell into the site, they are stem cell. We don't know how they are going to. In normal condition, they will, in the hope that they will control normally. But again, there are so many other factors associated with our body which determines that okay, we cannot say, so they cannot act any how they wanted to be like. They can divide. Maybe they can stop also. There are so many examples that give a positive feedback after the replace stem cell therapy. So one thing is like eye vision, some ocular ID regenerative disorder were there. So they used some stem cells therapy for that. So that patient actually got the vision improved after time. And there are also some previous history, like after doing the stem cell therapy, it was fine. But after some time, the risk of teratoma formation happened. So there are multiple examples like this. Positive are also there, negative sides are also there. So it varies. Did you understand?
Yes, ma'am.
Yeah. And also in the spinal cord injury nowadays, there are so many stem cell therapies are happening. So you can get multiple purpose.
Okay.
Okay, then can we stop today? Is there any other question? If there is no other question, we'll end it today.
So the stem cell therapies are being used to cure any other diseases not related to brain and spinal cord.
Brain and spinal cord, yes, there are researches going on in level of this stem cell. So why this field is this much delays? I told you, people are unaware of the accessibility for the stem cell present across the brain up to now. And the second problem, whenever there is neurodegeneration happens, these neurons also will start get dying off. That is another risk. But therapies are there. You can check for the papers. You will get it. But there is not complete cure for all these neurodegenerative disorders up to now. But spinal cord injury, yes, there is positive feedback. Like I have read one paper where there is a really positive feedback using after using the stem cell therapy for that part. So yes, there is. But Alzheimer's, in my knowledge, I don't know. I need to check.
Ma'am, also one thing, this L-DOPA you told it's a drug, right?
Yeah,
So
it's
will
an
there
amino
be any
acid.
side?
Levodopa
Yeah,
is an
it's a
amino acid.
tyrosine. I think it's tyrosine converting to dopamine or something like that. It's an amino acid. But
Yeah.
will there be any side effects if we give this drug to the Parkinson's patients?
So that I don't know. Actually, I need to check. But the only thing is there is at least a possibility. So look that there is a fact that there is no cure for the disorder. So people are just finding out that to increase their life expectancy up to some more extent, if we can give something. So whenever we are giving this drug, they are finding out that there is a cure like there is a decrease in their that disorder, motor coordination activity. But there must be some disorders also that I need to check. I don't know much about that.
I have read papers on Parkinson's, and it states that there is, but um,
Okay,
the
good.
side effects are not yet cured because they
Huh.
only know to supply dopamine, but not to cure the side effects.
Okay, okay.
Researches are going on to reduce the side effects, but still, but the people with Parkinson's, they are not able to survive if dopamine is not being supplied, and the only
Yeah,
way to
that's
give
what
is
I
this.
said. Something do better than nothing.
The only way to supply is this L-DOPA, but also the components in the dark chocolate contains dopamine. So won't that be an alternative for L-DOPA?
Then again, the thing, the dopamine cannot cross the blood-brain barrier, right? Only L-DOPA can diffuse the blood-brain barrier. It's depending on the molecular weight and also the phobicity of the component.
But it is stated that the people who have dark chocolates, the people with Parkinson's who have dark chocolates have a significant improvement in their
That is
cognitive
interesting. I
abilities.
don't know. I need to. If that is the case, it's interesting. I need to read that paper.
It's actually, ma'am, it's actually. But the problem with dark chocolate is, see, the people having Parkinson's will be mostly elderly, like above 60s. There is no time limit for when Parkinson's can occur, but
Yeah, it's
usually it
mostly
happens in the elderly people. But
yeah.
the problem with dark chocolate is they will be having diabetes. They can be prone to diabetes if they consume dark chocolate more than an amount per day.
Okay.
So that can be an issue, but the people who don't have diabetes can actually have it. But the alternate there they found is you can extract the components of dark chocolate and give it to them, which contains dopamine, so that the problem of diabetes can be avoided.
Nice.
So that is also being under research how to extract that. Like the
Yeah.
components of dark chocolate, like methyl xanthan, some components is there which is acting as the precursor for dopamine.
Mhm.
So that is also happening.
That's nice. It's normally it's like the normal dopamine cannot cross the blood-brain barrier. I read like that. I need to read more about that.
There is also one more probability that this Parkinson's have a relation with our gut. Even
Ah,
before the symptoms, onset of symptoms of Parkinson's, the patient will develop the gut-related disorders,
yeah,
which is
yeah.
a
Yeah, I also see that. And also regarding Alzheimer's, also there is increased risk with the diabetic T2 diabetic patient regarding the amyloid deposition thing. So all these some things are always correlated.
yes, ma'am. It's a gut-brain axis. They call it like that, and
Yeah.
it's a new field which is emerging right now.
Wow.
So how
So you
to
are
cure
interested
the
in Parkinson disease.
uh, actually, I was reading the papers for that, ma'am, so I got to know about that. I
Yeah.
actually went for a conference
Okay.
where I had to present a research poster which was based on Parkinson's.
Nice.
So I read about papers, also
Good.
with the probiotics. So I read about it, and while reading, I found that there is a relation between that. So I read more about that, and I got the idea, ma'am.
Good. Read more about it so that you can easily decide if you want to go for research, which path you should go ahead.
Yes, ma'am.
Okay, then it was a nice discussion. So can we call it a day? So bye then for today.
Okay, ma'am.
We'll see you next Saturday.
Okay.
Bye.
Bye, ma'am.
Bye, Tenmori.